It's your Biz to Biz with Joy, a weekly show where I interview men and women in business who are looking to connect with you, sharing their philosophy, platform, and how they serve you. Stay tuned. We love good company. See you soon. Cheers. You are live. Hello and welcome. Welcome to the launch of Biz to Biz with Joy. Grow your business in style. Business to business. That's what it's all about. And tonight we have Dr. Jessica McCain, who's going to be talking to us about a lot of what's going on now and how she can be very instrumental for you in that. I am Joy Ruffin. I am a style and leadership coach, a signature style specialist and professional speaker. And all of a sudden I decided it's all about business to business, and business, no matter what you're doing, it's vital, it's instrumental. You cannot be without it. And so no matter what it is that you're doing, it's about business. And for me, it's about being involved and impactful in the community. The community, there is family first, then there's community, and then there's relationships. And they all combine and align with one another. And you're not going to have any type of success unless you're involved in the community. So we began. And this show, Biz to Biz with Joy, is all about you. And if you're out there and you're tuned in, and I hope that you are, I want you to tune in and listen. And if you have a message that you want to get out to the public, then I want you to come and be a guest on Biz to Biz with Joy, how you can grow your business in style. And over the next few weeks and months, on a Tuesday night at 7 o'clock, I'll be sharing all of this with you. But tonight, I want you to help me to greet and meet and welcome our guest, Dr. Jessica McCain. Dr. McCain, hello and welcome.
Thank you, Ms. Ruffin, and I'm so excited and honored to be part of your kickoff program.
Oh, it's my honor. It's my pleasure. I love the work that you're doing. Now, somebody said to me, you say that about everybody. Well, I said, because everybody that I invite on the show, I love. I love the work they're doing and what they're about and how they're doing it and all of that. So I know that you are a founding member of the Southern Comfort SOCO Clinic. So tell us how you became the trailblazer and got started with that company.
So Southern Comfort is almost a brand that we're starting to develop because we actually have a number of different initiatives. We have a couple of different businesses under the Southern Comfort umbrella. 3.5 years ago, actually, I was working at a 503(c) FQHC type of clinic, and it was very stressful because of all the government regulations, and it was the ideal medical clinic where I could see that I wanted to take my patients with the degree of care that I wanted to provide them.
Yes.
So I was looking kind of for alternative options. I liked integrative health, for example, nutrition and fitness and some of these other types of wellness programs. And at the time, I created Southern Comfort Cannabis Clinic first, and that is now live for 3.5 years, doing really well. And then in my mind, I had always actually dreamed of creating a solo practice, is what I have now. Southern Comfort Health is a direct primary care clinic, and we are in Fort Pierce, which is actually my hometown. So talking about coming back to the communities after medical school and residency, I studied abroad. I came back to the States and had a lot of different experiences. I came back to my hometown, Fort Pierce, because this is the city that I love. And so
I'm so glad that you mentioned that, Dr. McCain, because I wanted you to bring that up, but you're bringing it up at just the right time. Community is everything. And I didn't mention, and I'm so glad I was going to, that you were mentioning that you are a native Floridian and that this is your community. I love that. Continue.
Yeah, well, that is exactly it. So we have to think about, what is a family practice physician? We are the kind of unique brand of doctors that we liked a little bit of everything. We like the surgery, we like the OB, and we like just family and community. And so we treat the whole person, meaning their mental health, physical health, but also making sure they're successful in life in general. So kind of that everything type of practice is what family practice is to me. So Southern Comfort Health Direct Primary Care is a completely different healthcare model than what a lot of us are actually really, associate or, usually experienced with.
I think that you are definitely pioneers and trailblazers, those of you who are really getting big and heavy into the direct primary care arena, so to speak.
Mhm.
And it is something that's really, really new, Dr. McCain, for an awful lot of people.
Yeah.
Explain to us and share with us as succinctly as you can what that really means and what that entails for the layman who really
Yeah.
might not have a complete understanding of what that is.
Right. So most people, when they go to the doctor's office, they realize that they're actually not working with the doctor. They're working with the middleman in between, usually the insurance company, saying, yes, you can get that prescription. No, you can't get that procedure done, even though the physician really wants you to have those things, right? So there's always this kind of degree of red tape. The other thing too is physicians don't like it from their perspective as well. We get paid by the insurance company. So what direct primary care is, it just says, you know what, how about I work directly with the patient? We will solve what is the best for them. We will have a much more time because we don't have to deal with all the overhead of insurance processing. And we'll just directly make our transactions from patient to physician. And we are working then together for medical, but also for price transparency too. So it is providing affordable medical care with a level of quality that's so much greater because we don't have to succumb to a lot of the click boxes or the rules that we only have to have 7 minutes with a patient because we have to see 35 patients a day.
And you don't deal as much with the red tape that one does when they're involved with the
No.
insurance companies. Now, tell us pretty much as you can. I know it varies, but what type of person, client, customer comes to you predominantly?
It's really anybody. There's actually a lot of people who are working. Maybe they are in real estate. Maybe they're 1099 employees. Maybe they actually they are employees of a business, but the business doesn't offer any health benefits because it's expensive for employers to offer health benefits. So what we can offer is actually a membership. So patients would pay a flat monthly rate based on age, and they would have like unlimited access to me. So they could, if they got sick, they could see me the next day, 24 hours, 48 hours in general. And then I could provide a degree of care also that, each appointment is about an hour long. And then we can connect with community resources. And again, we highlight that because if someone has trouble hearing, we find that, oh, did you know there's a free resource where you can get free hearing aid phones?
Ah, good.
And so anytime a patient has like a particular need, it's always kind of our fun to put a little investigational hat on and see like how we can make this happen for our patients. We just go the extra mile because the usual primary care doctor has 3,500 patients that they see. In my clinic, we're going to top it off at 600, just as a flat number that we're not going to see any more patients. Those are going to be my members that I take just really good care of.
That's really fantastic. And I like what you said. It depends on age. Do you find or have you found that predominantly you have a younger group of people who come to you, or is it across the board?
It is honestly across the board because,
Good.
so currently I'm seeing ages 13 and up. And these, again, 50% of our patients actually still have insurance. It's not like I don't want someone to have insurance. I certainly do, because there's things I can't help with, those unexpected things, the thing that insurance was meant for, those unpredictable needs, right?
Ah, very well said. And that's
Yeah.
I was about to ask you, for the people who come to you, are they still able to, because many people won't know these things, Dr. McCain, are they still able to get and maintain a certain amount of insurance? I'm an old commercial insurance agent myself. So how does that play into those who come to be with you and keep and maintain insurance? How do you work in that arena?
Right. So say if the patient does have insurance, well, they may change their plan, maybe a higher deductible. Again,
Yes.
primary care takes care of 80 to 90% of your medical needs, to be honest. If we had enough time to actually sit with each person and tease it out and figure it out and do procedures, we wouldn't necessarily need to, have all these consultants at our fingertips and refer them out. That just delays care further. So our insured patients, they may like us just because they like having someone as their quarterback to help coordinate care with all these other specialists that they're seeing, which is great. You can still use your insurance if you want to do your lab work or you want your prescriptions, or I can order for labs or specialists or things like that. You can still have insurance, and that's absolutely fine. But what are you paying for, doubly for primary care? So a lot of them, you can actually choose plans that are cheaper at the end of the month. So you can actually pay me for your primary care and then save a lot and just have a catastrophic wraparound plans that just cover for specialists. There's options like health shares, which are a lot more affordable. So someone who goes without any coverage at all, I'm scared for. I don't want them to go to bankrupt, because they have a medical need that persists. So health shares are an option, and they just complement really nicely with the direct primary care model. Our prices are $49, $89, $109, $129 a month. And so some people really just find it, even our patients who have Medicare, they like the fact that I help them while they're in the hospital. That's a very scary thing to do without someone advocating for you.
I hear you, Dr. McCain, and loud and clear. And I love all the information you're sharing, but I always think about the layman who might not have the awareness and insight and knowledge that you have. So that said, explain to us a wee bit more in detail what the health share is all about. How do you mean, and what do you mean when you speak to that?
Health shares are not a form of insurance. However, it is a people that are pulling their monies together. And I'm not an insurance agent, so this is kind of also very layman's, very okay. Explanation. But it's basically they pull the money together. And so that way, if there's anything that's catastrophic, you know, they don't really cover for primary care. They really actually give extra discounts if you have a direct primary care physician, because they know we keep you out of the hospital a little bit better. So it works similar, but it's actually, they use different terminology and it's actually different price points.
I get that, but here's a concern that I always bring up, and it's always amusing to me. Who are the they people? Who are the
So there's a number of different companies. There's Sedera, Zion, Christian Health Shares. We actually carry a little bit of all the brochures in our resource room in our office for patients to get a little more information. And we can actually set, we can refer people to specific agents who are familiar with the direct primary care model, so they can connect them with whatever commercial plan is better. Maybe they actually do have some government benefits. There's a lot of different avenues to get more information, to find a direct primary care physician that has, you know, in a plan that complements really nicely.
Well explained, because I think a lot of people are going to be questioning a lot about, like myself, initially, what really can direct primary care, what is it going to offer me, and how will I benefit by it? That's what people want to know.
Sure, yeah. So just think about your your last experience when you went to the doctor's office. Did you have to sit in the waiting room? Did you have to take time off from work? Was it longer than you expected to be away from work? How far out did you have to make that appointment? Was it a month, 2 months sometimes? So first of all, you have access to me with my members. They actually get a cell phone that gets to my cell phone. So they have access to it. They have my email. We can do video chat. We were doing it long before COVID happened. So one is that, you know, when I say same day, next day, that's for urgent care. But if it's not an urgent care, oftentimes a week or 2 week, we have availabilities to see you. And, you know, even before then, we'll probably chat and make sure you can make it that long. If you're so sick and you can't make it to the office, I don't want you to come. I'd rather do a house call and make sure that you're feeling well and you have what needs. I've done a couple where I dropped off. We have COVID care packs, for example, set with medicines. Speaking of medicines, we actually dispense out of our pharmacy. We have Southern Comfort Pharmacy here, and we have discount medicine. So patients who have insurance, they would rather you pay our prices because they're 80–90% less than what retail pharmacies offer.
Let me cut you off and just speak to something that's really major for most people today, regardless to whatever arena you're dancing in, and that is you're able to speak to someone. Yeah. Technology is wonderful, and we all love it. You and I are sitting here now on and doing what we're doing on this platform. But you pick up that phone and you attempt to call, and you get machine after machine after machine, robot after robot after robot.
Or I'll transfer you. Yeah.
There you go. So what's really engaging with what you're doing is that the people who are aligned with you are able to connect with you or someone, and you're able to get some type of feedback or answer within a very short time. That's really, really major. How many people are on your staff or in your circle of people?
That's really interesting. So when I was working at previous clinics, we call those fee-for-service clinics, the ones that primarily focus with insurance patients. You actually, like a physician may have 10 support staff, from the front desk to the the referral coordinator, to your MA assistant, to someone just answering phones. And it's really a big operation when you look at this now. Yeah. And sometimes that's what makes patients feel like just a number, you know. And that's not what I want. So to be honest, right now, our patient load is handled by myself and my medical assistant, who also services as my office manager. It's just us two. We know our patients really well. And it's just a very intimate setting. Our clinic is actually an old building. It's a 108-year-old house that we just remodeled for a medical clinic. We don't have a waiting room. We have a living room. We want people to live. and people aren't waiting for appointments. Every appointment is blocked right now for an hour long. And sometimes the response we get from patients, like, I've never had a physician actually do a full exam. Like,
I bet.
if I really talked it out, it turns out, maybe I did have, some other things I was dealing with, and you hit it. Now we can really focus. When we have time to tease things out, we really get things done.
Dr. McCain, you're speaking to a lot of very vital information that people will want to know about when it comes to direct primary care. And what you're speaking to is what I initially opened this show with, because this is what I've learned in my time here on this planet. Family first, community, and relationships, and they all align together. And what you're offering to that person who comes to you for the services that you're offering, you have extended into an extended family, building a relationship so that they feel cared for, they feel seen, they feel heard, and that you are recognizing them for who they are, knowing that maybe they're not at their best when they arrive to you. I think that's monumental. And when I use the word trailblazer and a pioneer, I don't mean for you to put a tiara on, but it's the truth. Because when people are doing something like this that brings people into a circle, a tribe, a family environment, it's always good. How did you decide, and what was your deciding factor to do this, to have this clinic for those? Something prompted you to initiate and begin this.
I mean, part of it was my own family. I found that, unfortunately, there's not like a union for physicians. And so we get a lot of, sometimes we put a lot on our shoulders that we're responsible for. And I found myself after hours doing charts that I just found were not even pertinent to real patient care. I was just doing check boxes for the insurance companies. And I was staying up and missing my own family, just finishing up those notes. And I felt that was not, if I was going to invest in a patient, I want to make sure I'm actually investing in them the right way. And I felt like I was telling them, sorry, I can only address one issue today because that's what my, was told. I just don't like that kind of care. I want to make sure we're more intimate and we do have a relationship. And that way, there's some mutual, and I like giving the patients, like, let me teach you and you take it from here. So if I have more time to educate, that is exactly when I'm going to actually see patients getting real health benefits. And healthcare is just so expensive, and people go without because it's inconvenient, it's impersonal, and I just feel like direct primary care resolves a lot of those things. And people who were previously neglecting their care, we've had some huge successes already. We've already saved a life. I know for a fact we've already saved some lives.
Fantastic. I think it's great. And I love the way you address that question, because it really is all about family, community, and relationships. And the name that you've come up with, Southern Comfort, because you are a Southern girl, and it's all about comfort, making someone, helping and supporting someone to feel at their best. And you do that by making that intimate connection. They're not just a number. They're more than that to you, because you do care about what you're doing. This virus that we're all dealing with, this coronavirus, it's deadly in so many ways. And yet the health field that you're in, the work that you're doing, a little bit different. That field is wide open for people to come and to get work and to find work. So you said that your staff is pretty much small at this point in time, yet I'm sure you're always on the lookout for those who will become part of your circle, of your tribe, and will help you to expand what you're about and what you're doing. So how do you look for, and what do you look for in someone that you want to surround yourself with?
So actually, as far as the clinical team, it's myself and Ginger. When the phone rings, people are sometimes surprised when I'm the one answering it, because I'm answering my own phones in my medical clinic. That's just how we roll here. I actually do have a pretty big team, because the Southern Comfort brand is expanding. We have Southern Comfort Health, which is the direct primary care, but underneath that, we want to expand Southern Comfort Wellness. So we actually have nutritional products now, kind of in a more retail. We're going to be having some other services we roll out to patients. That's one thing, Miss Joy, I want you to kind of really emphasize with the direct primary care. It's not just you're seeing your doctor and we've got a great, finally we got a great quarterback. We offer a lot of services that make this worth the value. We know that the membership model isn't for everyone, but once you're inside it, you'll really appreciate the value that you're getting. The notes and emails that are sent to you from me for reminders. That's one thing. But we, like I mentioned before, we also dispense medications at 90-day supply for $2. Sometimes it's kind of like, you realize that same medicine is retail $50 at the pharmacy.
I hear you loud and clear. And I want to get back. I'm going to take a brief intermission here, but I want to get back and I want you to speak more to that, all of the different services that you offer and how you offer them. But just hold on for 1 second. I'll be right back with you. And what I want to do now is invite you, whether you're here now or you're coming for the replay. This show, Biz to Biz with Joy, Grow Your Business in Style, it's all about the community. Now it's for the Floridian community, but we're going to be expanding. But what I want you to do is to connect with Dr. McCain, because the work that she's doing in the community is phenomenal. And all of us need to explore, investigate, and research everything that's going to help us to be all that we can be and to be better at it. Because we're all here to rise and become our best self. Now, Oprah coined that, but it applies to all of us. So I'm going to be putting up her name, her website, and her email address. And your assignment, you know that I love the movies, is to make sure that you align with her. Send her a little message and connect with her, because this is something that's rather new. And the sooner you get in to see what it's all about, the better it's going to be for you. So make sure that when I put up the name, the website, and the email, that you in turn will align with her. Now, Jessica, what you can do, Dr. McCain, is explain to us a wee bit more about all the different services that you offer from the Southern Comfort Clinic that you're all about.
Right. So our members get extra discounts for our SoCo Wellness line. They get discount medications dispensed at the time of their appointment if they're sick, really at 80-90% discount. We do procedures for our members. So like, for example, if we need an IV bag for hydration, people are paying sometimes $200 to go to these lounges. Our members would get that for just the cost of what the medicine and the tubing is. So that's like $12. We also, are reinvesting into our clinic. So that way, we're not sure if someone has diabetes. Let's loan you a glucometer so we can set out. Or if you're having, palpitations, your heart is racing, not sure what that's all about. We have like a take-home EKG device. We're going to be having take-home oxygen devices, so that way we can know if it's worth the investment to pay for a real sleep study. So, we always mind our patients and their finances and make sure that we're doing the right proper steps. Another really big thing that our memberships include is we actually have access to specialists. I have a membership with a third-party company called Rubicon. And basically, they subcontract out 120 different specialists from, bariatric surgeons, cardiothoracic, pediatrics, nutritionists, anybody that are licensed. And I can send patient cases, go back and forth, ask questions. So oftentimes, if a patient comes to me and they're, especially if they're uninsured, that's a big cost just to go to another specialist. So we can always run it by kind of like as an informal consult to make sure we've really done everything we can at primary care before I'm asking a patient to take more time off, spend more money to see another specialist. I want to make sure I'm practicing at the top of my potential. So
understood.
Yeah. And so anything that requires like my services, for example, like we have, someone cuts themselves, no cost. That's part of your membership. We want to make sure that you're taken care of. You have a mask that wants to get taken off. Well, you're just going to pay for the pathology, for the lab work, not for the service of it. So those.
You mentioned, Dr. McCain, a word there that I wanted to find a way to ask you about. And this might not be an easy one for you to answer, but uninsured. How much and what percentage of people who are uninsured arrive at your clinic?
I think we're 50-50.
So
we have, so about 50% of our patients are uninsured, but that doesn't mean, again, they don't have anything. They don't have commercial insurance, but they may be part of a health share plan. My family, for example, is now part of a health share plan. We gave up the commercial insurance. We save 50% of our healthcare budget every single month, and we're putting that towards other healthy mental health needs for our families. So we're more together.
I wanted to hear you mention that, Dr. McCain, because I think a lot of people, and I'm assuming sometimes, which is deadly, but not always, that are a lot of people who could use your services who maybe are uninsured, who hesitate for numerous reasons. And what you're saying is come in, let's chat, and let's see if you would be a fit. And if I can support and help you.
We encourage anybody in the community, if they want to come tour our facility, we have people in every once in a while that just want to see what this is all about. The vibe, the feel that you get. We're really taking off with our memberships with patients, who we have, telling their family and their friends. So it's getting pretty busy, but we're doing pretty well. And I feel like we're making a huge impact. And, even just working with other specialists, I send faxes, just letting you know I'm changing something for, I have specialists call me back. They're like, nobody's ever really taken that effort on behalf of a patient. Thank you. You know, I'm glad you kept me in the loop. I'm glad you kept me in the loop. Thank you. So
I think it's
trying to bring back
fantastic.
you know, unfortunately, we have lost a lot of collegiality in the medical field just
Yes.
because we're all just disgruntled. It's not just patients disgruntled, it's healthcare workers are disgruntled with the system. And this is just one way to make primary care, which should be a huge part of your life. We talk about healthcare expenses. Well, think about this as like your Netflix. So we are your Netflix.
What an analogy. Yes, it works.
Well, once healthcare becomes affordable and accessible, it's going to start becoming a priority for people. So while it's not, some people have really neglected their health, and we can help be part of their health and their wellness.
Dr. McCain, I tell you, you've given us so much information here, good information. And my prayer, as my mother would say, is that people will align with you and get to know you. Everything takes time. But I want to ask you this, and it's a question that I'm either going to put off or you're going to address. What gives you the most pleasure? What fills you up the most with the work that you're doing, which is monumental in so many ways? And I'm so delighted that we're connected now. But tell us and the audience what fills you up the most.
I think our clinic in general, like we have some other staff members here too, part of the administration team. We love challenges. We were told that we can't do it. We are going to find a way to do it for our patients. I love that, you know, I have people going without healthcare, and then, you know, I have a gentleman who lost his insurance recently, and he's like, how am I going to pay for these medicines? I said, don't worry, let me figure this out. I'll source it. And so we compared to GoodRx. My prices came out underneath it, and he's like, I'm going to be able to keep myself like together and healthy because of this. So it was actually the cost of his membership and beyond. So he's actually saving, you know, the cost of his medicines with the insurance was the cost of my membership. So there you go. We had a woman who was without any medical like care as far as female care since 1995. I convinced her to do a pap smear, join our practice. Our pap smears are $22. We found cancer. She didn't have insurance. Well, you know what? My staff member, Ginger, she found Brevard County. They had a closed colposcopy program where they biopsy the cervix, see if it's cancer or not. She convinced them to reopen the program. They did. They took our patient, cancer. Now we've got her set up with Medicaid. Another county actually helped us out, and we just connected with doctors and other, like we will go the extra mile if we need to. And now she's cancer free, 2 months to the day. So even in for service, if you're in the regular medical field, like even with you, when you have the Cadillac of insurances, you're not going to have all that happen in a period of 60 days.
I like that. Dr. McCain.
I'm a real big advocate.
Time flies here. It goes so quickly, and you are a powerhouse. And let me say this to you. You couldn't have ended on a better note. And you know why? Because I asked you what you enjoy most and what gives you the most pleasure and fills you up. And you said a couple of things, but what you left me with and the audience, you like a challenge. So if there's anybody out there who's questioning this, that, or the other, go and see Dr. Jessica McCain. I thank you for your time. It really was delightful. And you are really more than informational in how you share with the audience what you're all about. I'm going to ask you to say so long for now. Step into the green room and don't go away. I'll be with you in a second. I'll see you soon.
All right, Ms. Ruffin. Thanks so much.
Thank you. You are more than welcome. Don't you love it? When people come and their message is clear and they're aligning with you, with what they do, so that you can come, seek, ask questions, that's what it's all about. This time goes and it goes so quickly, but here is the intention for this show. Biz to Biz with Joy, Grow Your Business in Style, is all about supporting you, helping, aiding, assisting, and guiding you to find every avenue that's out there to grow your business. Now, Dr. McCain has a good business, and it's a pioneering, trailblazing type of business, somewhat so. Yet, you are invited to do your own research and to check in with her and to see what they offer and if it will benefit you. And most likely it will. And there's so much more that she's doing that we just didn't have time to probe and go deep into, but you will. So there is a name and an email address here and a website that you can go and check into everything that's going on there. And need I say welcome? It's always good to see you here. You are a delight. I appreciate your time and your attention. And remember, every Tuesday night at 7 p.m., Biz to Biz with Joy, and some leading guests, featured guests, here in the Floridian community. Until we connect again and soon, you be and stay well. During this virus that we're all dealing with, whatever you do, when you're out and about, wear that mask for you and for others. Until we connect, you be and stay well. All the best. So long for now. Cheers. What happened? Well, hello and welcome. We are live. Good evening. We're going to talk about Biz to Biz with Joy, how you can grow your business in style. And tonight, our guest, is an internationally recognized shopping television network hostess. And let me tell you, when we talk about being real, being authentic, and all of that, that's what you're going to meet tonight with our guest. This show is all about men and women who are in business, who know that the future, it always was, but now more than ever, it's online. So whatever it is that you're doing, you have to bring it online. So our guest tonight, her name is Kelly Ulver. I never pronounce her last name correct. She'll tell me. And you're going to absolutely love all the information that she's going to share with you. Kelly has been about in the beauty skincare business for quite a while. Her story will mesmerize and fascinate you. And so before I could go on and on and on and on about her background, but you want to know, how is Kelly, what is she doing now that's going to benefit me? So let's say hello to Kelly, and we're going to discover what that is. Kelly, hello and welcome. So nice to have you here.
Hello, Joe. It's so great to be asked back. Thank you very much. And hello to everybody who's sitting at home right now.
Oh, bless your heart. I absolutely, you know that this is a mutual admiration society that you and I have going on here, because we're doing the same thing in a different vein. We're dancing in different lanes, but we connect every now and then and we twirl. And it's a good thing.
It's a good twirl.
So let me just share with the audience, Kelly, before you tell us a little bit about what you're doing now and how it's going to benefit them. I had the honor of attending your masterclass today, and it was spellbinding in so many ways. So before you share with us what that was about and how you brought that to an audience, tell us how you got into this fascinating business called beauty and skincare.
Oh my goodness. Oh my goodness. Wow. Well, I can give you the long version or the short version, but I'll give you a little bit of both. So
Okay.
when I was a little girl, I was a tomboy, and I was too shy and self-conscious and insecure as a little girl to say I was interested in things that were like about beauty, because I was a tomboy, and tomboys don't do things like that. So that was always in the back of my mind. Fast forward many, many years. It was only by fluke that I got into the beauty industry, because I'd always been in sales and marketing. And long story short, I moved to Toronto and I needed a job. And so I got a job spraying perfume at the Estee Lauder counter, believe it or not. And from that, I just fell in love with the world of skin, the world of skincare, the world of fragrance, the world of beauty. And I was able to take my experience, my expertise, coupled with I have a scientific background because I was going to be a doctor. I was studying to be a doctor, and I love research. I love science. I love knowing how things work. It was from that I was able to get a job or being a host on a shopping channel. And I did that for over 20 years. And I created my own multiple skincare lines and sold them on shopping channels all over the world. And I keep coming back to making more skincare lines because I want a skincare line that works. And I know how to make it work because of the ingredients.
Well, timing, they say, is everything. And now you're timing with what you're doing for that woman. And she doesn't necessarily have to be second chapter, second act, midlife, because skin issues occur all the time. But this anti-aging, Kelly, no one wants to age. But you and I both have a saying that I adore. Aging is inevitable. Growing old is optional. You're about sharing with people. So now I love also that you added to this that you've always been very, very deep into research and a scientific outlook.
Right.
So that being the case, when was the pivotal moment for you that you knew that skincare was the avenue that you wanted to travel on?
You know, it was actually after I had left being a host at the shopping channel, and after I had I'd already launched one skincare line, and I loved it and it was successful. But I had crepey skin really, really bad. Like I was getting older and my past caught up to me. And I kept trying Creepy Skin products and other skincare lines that would address thinning skin, thinning creepy skin, and nothing was giving me the results that I wanted. And I said, that's it. I'm just going to put my nose to the books. And I grabbed every academic journal, medical journal, research journal, and I really learned everything there was to know about skin, what happens to skin, what causes things, how to correct it. And that's how I fell in love again with research. I fell in love again with science. I fell in love again with skincare. And I love putting the pieces together, because once you know what works and what doesn't work, you can make anything in skincare, because there's really just core ingredients that are game changers. Like there's lots of kitschy marketing things out there, like really fancy names. But you know what? It comes down to the core, basic core ingredients, the workhorses that are going to make change in your skin.
Kelly, today, attending your mastermind, for me, it was so profound and fantastic in so many ways. I hope that you're going to make that mastermind evergreen. And we're going to talk a little bit about that later. But you spoke to something that's really crucial, especially for us women. And that is, sometimes we know all the things that we have to do, should do, ought to do. And yet, what happens? You mentioned something today that few people speak to when it comes to taking care of our temple. And that is our learned behaviors that lead us down a path that's not beneficial for us. So
yeah, absolutely.
About that to our audience today.
Yeah, sure. You know, these learned behaviors are what I call limiting beliefs. And a limiting belief is basically, the dictionary calls it learned helplessness. And what that means in English is that in your life, you follow a set of rules for yourself. And that might be a thought, a belief system, or an action that you decide that that's the way you're going to live your life. But the problem with limiting beliefs is that they limit your potential and getting the most out of your life. And these limiting beliefs, you don't make them, you learn them from other people. You're born perfect. You're born with this amazing, fabulous computer brain that's a blank slate that's just waiting for coding to come in. The problem is, we are surrounded by people who may not be the most healthiest, who may not be the most aware, who may have some of their own limiting beliefs that they've picked up from their family members as well. And now they're imprinting them on you. And so then you're walking around living your life based on somebody's version of reality. And that's really not what we want. We want to live in our own sense of reality, what we think is right and wrong.
Well, hallelujah, because that's a fact. But here's what happens to most of us. You mentioned something else today. Women especially, I don't think men do this as much. I haven't done my research on it, but something tells me not so. There's that comparing thing.
Absolutely.
She's this more than I. She's this more than I. Her hair, her eyes, her look, her makeup, her clothes. Don't compare, because what you said in your mastermind was, for me, brilliant. Every woman, because this is how I see women, every woman is beautiful.
Absolutely.
Our assignment, should we decide to accept it, is to discover how to bring out the essence of that beauty. And I feel that that's what you're doing.
Yeah. Well, thank you very much. You know, I didn't grow up believing myself to be beautiful. I had extremely low self-esteem. I had a lot of self-hate. And unfortunately, that was the program that I received. And I was also told I was very unattractive growing up. And my father withheld love and love from me because he said he was ashamed of me. That stayed with me for a very, very long time. And I did not allow my inner light to show. I was always very self-conscious about it. And women today still do that. But one thing that I've learned is that we all have this amazing essence about us. The key thing is to look underneath the hurt. Whatever you're feeling, whatever is going on in your life, if it makes you feel uncomfortable or a little agitation, take a moment and stop and say, okay, what's really going on here? I'm really angry. So what's underneath the anger? And generally you'll find what's going on. And maybe you're just feeling that I'm not good enough. There's something wrong with me. And this is where it's time to reprogram your self-conscious mind to tend to your inner child and your internal critic, because they're the ones that were wounded. They're the ones that got the brunt of all the abusive behavior and negative comments and feedback. And being a little 5 or 6 year old and getting all this information, you haven't yet developed yet. You don't understand. It's what does this mean? This is unusual. So that little inner child needs to be tended to. That inner critic, your subconscious mind needs to know that everything is okay. And it needs to know that you're doing a job, you're to take care of yourself. And that comes with baby steps, and that comes with self-care. Now, I know you might be, self-care, fluffy, duffy stuff, because I used a self-care. Who the heck needs that? I'm just powering through. I got work to do. I'm powering through. Joy, I did that my entire life, and I powered through until all of a sudden it's like I broke. I stopped. I worked like a dog. I put myself last, and all of a sudden it's like I can't do this anymore. And I started spinning and spinning. And it wasn't until I stopped and gently peeled back the layers and started paying attention to me. Simple acts of kindness. For example, at nighttime before I go to bed, take about 3 to 4 minutes and take a brush and brush my hair. And not just brush, but feel the brush on my scalp, feel the brush going through my hair, experiencing it, paying attention to it. Because when you pay attention to these simple acts of kindness, this is an indicator to your subconscious mind. It picks up this new coding, because it's coding, because all of a sudden something new is coming in, a whole different thing.
I get it. I really get it. You're preaching to the choir, because for me, it's different verbiage, but it's the same outlook and mindset, meaning that self-care, that personal development. And one of my many coaches, brilliant young lady, said that personal development is great, but it has to go beyond that. And so that looking after yourself,
yeah,
doing everything that you can to rise and be all that you can be, you can't do that if you're comparing with every and whoever is next to you around you. You've got to develop the best of you. Yeah. And that's why I like what you're speaking to. And what I wanted you to speak to a wee bit before we get to the glow getters and all of that that you're doing now is that comparing thing. That comparing thing will
nasty. You know, we live in a world of we live in the world of smoke and mirrors, where everything is false. You know, it's filtering, it's lights, and it's an unrealistic expectation. But it goes down to this: why are you even comparing yourself to someone? That is what's more important, because each and every one of us are our own unique. Look instead at why do you need to compare yourself to that other person? Because once you figure that out, you will never, ever compare yourself to someone else. You will instead keep that energy in, and you will focus that on you, and you will get this incredible glow from within, and you will start to live the life that you know you were meant to be. You will glow from within. You will thrive with happiness, and everybody will want to know your secret. They'll want to be you, because you got what they want.
I love the title that you gave your mastermind. And that brings me to the key 3 secrets, the inside secrets that you revealed. And you revealed them in such a good way that people could engage and embrace. So share with us those 3 secrets, because, you know, in addition to the beauty and the skincare and always being and looking at your best, feeling and all of that, you're talking about what's underneath. Uncovering and letting it come out so that you can glow. Yeah. Because you can't glow until that happens, right, Kelly?
You just gave me God bumps when you said that. It completely resonated with me. You know, beauty is way deeper than skin. Beauty starts from within, and it starts with your mindset. It starts with how you feel about yourself. So, but putting that aside, the 3 things that I spoke about in my mastermind, which was secrets. Well, the mastermind was called Get Glowing. How to ignite your inner glow getters, get more confidence, eliminate fears and insecurities and self-doubt, and get what you want. So the secret number 1 was the number 1 thing you must do to get rid of doubts, fears, and insecurities. And number 2 was the number 1 confidence killer for women and what to do about it. And number 3 was the number 1 skin sin.
Yes.
You start from within. Doesn't matter what your physical form looks like. What I call it the vessel, because we are truly spirit having a human experience. And we've got this. I heard this term the other day. We've got our skin carrying around a sack of bones. So, it's the soul that's inside that is the true light. And if we can clear out the clutter, clear the clutter to allow that soul to be shine the way it was meant to shine, then that is truly a happy life. But how to get rid of doubts and fears and insecurities. All right. So the number one thing that
you used the word today, Kelly, that really resonated with me. And thank you for the compliment that you just gave me. And that word was believe. And you took that believe into different stratospheres. So share a little bit about that with us too.
Okay. Let's see if I can remember what I said. So the first thing, in order for you to get rid of fears and insecurities, the first thing that you must do is to get rid of fears and insecurities in order to get what you want, okay? Whatever that is, whether it's being president of the United States or losing 10 pounds, the first thing that you must do is believe that what you want, it's possible to get that. You've got to believe it can be done, because if you don't believe that it's possible, you'll never achieve it. Now, for example, my clients have a difficult time with that. I'll share a story with you, quick story with you if I can. A gal of mine, I'm working with her. She's wanting to get into shape and have a healthy, fit body and lose some weight. So she looked at me and she said, "You want me to believe that I'm going to take your absolutely ageless eating program and your absolutely ageless movement program, and I'm going to follow it, and I'm going to lose those last 20 pounds and it's going to stay off? Are you kidding me? I have been trying to do this 1,000 times and I've never had any success. It's gain and loss and gain and loss and loss and gain and loss and gain." And I just looked at her and I went, "Yeah, that's all you have to do is follow the plan." She goes, "It's never going to work." I said, "But you have to believe it will." She goes, "Well, how can I believe when I failed so many times?" I said, "What you have to do is change your beliefs, because what you are thinking is not serving you and it's preventing you from getting what you want." And this brings us into limiting beliefs. The fastest way to get rid of a limiting belief is to identify what is holding you back, such as "I'll never lose weight," or "I'll never find a husband," or "I'm too old to learn," or yes.
I want to stop you right there, because when you said that, you know that I'm working with women who, terminology is terminology, but second act, second chapter, midlife. And so many women get to that area stage of their lives and they feel, well, no sense in attempting to look this way, be this way, or what it really is to be spiffy, younger, and fancy.
Well, that's a belief system. That is a limiting belief.
That's it exactly. That's why when I heard you say that, I'm saying really there's a collaboration here, because I don't believe that a woman gets to be any age and all of a sudden she stops. I think if anything should be plugged.
Well, she's learned that. She's learned that behavior. She's watched her mother. She's watched her grandmother. She's watched people around her. So that is her expectations, and that's what she thinks she must have. I mean, I remember a long time ago, I decided I didn't want to age like my grandparents did. And because I was looking at them and I'm like, whoa, but I thought, well, that's the way it was going to be. And then I got social proof that that's not the way it had to be. I met my cousin Wendy. She was only around 30 years old, but a 30-year-old when you're 6 or 7 or 8 appears to be ancient. But I looked at her and I thought, she's old, but she doesn't look old. And I want to be like her when I grow up. So if she can be like that, so can I. And that was when I adopted a belief system that I was not going to age like my grandparents did or like anyone else did. And that's part of your coding. If this is what you truly, truly believe, you have now put brand new coding into the gray matter up here. And that's what your brain does. Your brain takes in coding and then it gives signals to your body, signals to your body to do the appropriate actions in order to get the desired result of the coding in your brain. Very important to note, very important to remember this. And it's because of this, that's why it's very important to change your limiting beliefs, because if you don't, you will never get what you want. No, whatever, anything in your life, big or small.
You're speaking to the choir. I get it at this time and stage. Kelly, I'm going to ask you to just step aside for one brief minute. Don't go anywhere. I want to say something to the audience, and then I'm going to be right back with you. And what I want to share with you is this. This is a new show, Biz to Biz with Joy. Grow your business in style. It's initially for all the Floridians everywhere. Those who are aware that online everything is the way for the future. It always has been, but now more so than ever, and that we're in this pandemic. I'm asking you to join Leading Ladies Leaving Legacies. Now, this is for men and women, but if it's a male, then there's a group that we're going to put together. I haven't quite decided how I'm going to do it, but what I want you to be able to do is to connect with us here, because just like Kelly and all the other businesses and nonprofit groups and all of the other commercial, mom and pop, whatever it might be, we're going to bring them to you, and then we're going to take them out into the stratosphere, any, every, and all places where they can get more exposure. So if you're out there and you're a Floridian and you have a business, entrepreneurial, mom and pop, it doesn't matter what type, but you want to learn how to get more exposure, then I'm inviting you to come and connect with us here. And I will put a link up here later for that. But now I want us to go back and I want to chat with Kelly. And Kelly, what you're doing and what you're sharing with us is powerful. Now tell us a little bit about the products and what you're offering to those who are interested in having a more, I like the word youthful. Ageless is important. Anti-aging is great, but most people want to have a vibrant, energetic persona and everything. So speak to us a little bit about some of the products and what you're offering to those who are interested in this type of.
So I'm not sure I understood the question correctly. So are you talking about physical products that I offer to have a vibrant life? Okay, physical products. Okay. Well, okay. So I'm assuming it's my collagen product and my skincare. Is this what?
Yes, that's what you spoke to. Collagen, protein.
Yes. All righty.
But and thank you for that, because sometimes I get excited and carried away myself. What I'm asking, and I love that I do. What I'm asking is that you to relay to those who are here now and those who will come later, some of the products that you have that will benefit them and their evolution and evolving to have the type of skin and image appearance that they're looking for now.
Okay. All right.
So clear for you.
Yeah. Close enough. So I because I've always loved skin and been interested in skincare, I created multiple skincare lines, but I was looking for one and my skincare works. It's got all the right ingredients, and women of all ages can use this. So if you are more like, you know, in your late, oops, sorry, that's my sister. Sorry. Okay.
I love it when these things happen. Go ahead.
If you're looking to keep your skin in the condition that it is, my skincare works for you. If you are looking to make corrections on your skin, my skincare is for you, because there's only so much change that you can get from ingesting products such as my collagen. You need an inside-outside approach to do that. But if there's one product that I could recommend for anybody that can transform your entire body from the inside out and work on all areas of your life, it is collagen protein. I created collagen protein product for myself because I wanted to, I heard collagen protein was good for your skin. This was back in 2013. I've been drinking this product for 7 years now. And that's one of the reasons why my skincare looks the way it is. It's one of the reasons I have a zest for life, because collagen protein contains 21 of the 22 amino acids in very high concentrations, in particular, the ones necessary for making collagen, beautiful skin, having more energy, better digestion, healing the gut, better night's sleep. And of course, when you have all of these things, when they're all working together, and you're getting an excellent source of clean protein that does it all with it's pure protein, no fat, no cholesterol, non-GMO, hormone-free, pasture-raised, halal, kosher. It's all of these wonderful goodies, and it's a food source. This is something that I would encourage everybody to have in their eating plan.
I like it that you are, and here's what I know, because many years ago I was introduced to collagen protein way before it was the buzzword, which it is now. And I have to tell you what I discovered back then, Kelly, and I want you to speak to this a wee bit, because we are so, meaning we, the American people, I love that expression, and I'm talking international as well. We're so carried away with expedient, speedy, right away.
Oh, okay.
This product, Kelly, is the bomb, as the kids say today. Yet, it's not overnight. It's not the Holy Grail. It takes some time for your system to acclimate and for you to get you. But when you do, you will begin to see the improvements in your skin. So
You know, one thing though, Joy, so long-term benefits for your entire body, like bones and
yes,
joints, aches and pains,
yes.
arthritis pain. Studies have shown. The when you take it all the time, like I have been, the benefits stay with you.
Mhm.
And when it comes to like aches and pains and arthritis, you're looking at about 8 weeks to see results. Now, when it comes to skincare, when you take collagen protein, you can see the difference in your face within 4 weeks. 4 weeks, your skin is lifted, your skin is firmer, thicker, brighter, more hydrated. Sunspots go away from taking collagen, and that is only 4 weeks. It's not an overnight success, but life is not an overnight success. Life is a journey.
Yeah.
There's always going to be another harvest. There's always going to be another day. It's those people that stay the course that get the results. The way I look at it is you have to eat. You've got to eat, and you've got to have protein in your diet. So why not choose a protein source that is more effective at making collagen 10 to 20 times more powerful than whey, soy, and plant protein and pea protein. Why? Because of the amino acid, getting science on it. But the amino acids inside, their job specifically is to make more collagen, to strengthen thinning skin. It's just a no-brainer just to add it in your coffee, put it in a smoothie. It just makes so much sense. And it's an affordable way to get one of the finest beauty treatments that give you long-lasting results. I'm 60. This skin is 60 years old. I do use my skincare for like resurfacing. But it's the 1-2 punch. What can I say?
You can't say much because it shows. But let me say this, though, to you, because the whole intention for this show is for the Floridian community, but I want people to connect. So
Okay.
I have up your website, your
Perfect.
email address.
Thank you. I would love it.
And what I want you to do is tell people a little bit. We don't have much time here,
Okay.
Kelly. The time flies. You and I could go on and on and on.
I love being on air with you.
I love it's mutual. But I want you to share with people, I have your website here, how they can connect with you. And also tell them a little bit about your masterclass. I'm going to put the link up later, how you're going to promote that and how they can connect with you to learn more about your products. That's the intention for your being here.
All right. So my email address is Kelly, KELLIE at KELLIEOLVER.com. There it is. So you have that directly. You can get there with me. I'll give you my phone number because I'm a Floridian. And I don't know if Joy has it, but I will do this. So you can text me. Always, I rarely pick up the phone. I'm really busy, but I will always respond to a text. And my phone number is 310-849-2410. If you're looking for my skincare, you can, if you want to find out more about my skincare, more about my masterclass, and of course my 6-week home digital course, and it's called Absolutely Ageless: How to Get Beautiful Skin, Boundless Energy, and a Fit Mind and Body at any age and get what you want. And there is so much information there on food and eating, and of course the power of the mind, retraining the mind, getting into that space where you have the mind, heart, body connection, where all things are possible for creating. I would love to hear from you. Just tell me that you're Joy's friend, and then I'll know.
And here's the beauty for those who are listening now, and for you, because I don't know if I mentioned it. What's really great about Biz to Biz with Joy, I have a line. So we are going to be connecting you with Roku, Amazon Fire, and we're in the process now of finalizing with Apple TV. So ultimately, this will be going out into the stratosphere. We have a little bit of work yet to do, but trust me, and I know, Kelly, that we only do top of the line. So for those who are coming into the fold in the near future, bear in mind that the exposure that you're going to get will ultimately be absolutely phenomenal. And you can take this video, which is what hopefully Kelly will do, and I'm sure she will. You can dice, slice, splice, and post it. Promote it wherever you like. It becomes yours. Kelly, you are a dream. You really are. And you glow from the inside out. And I'm so happy that we're connected. And what I can say now is I'm going to put you in the green room. Say so long to the audience. And
bye, everybody. Thank you so much.
Thank you. Thank you. And what I'm going to do is say so long to you for now. It's always good to be with you. And this show is new and we're evolving. And I'm so thrilled for those who are coming on to share what they're doing in the community and for others, because we're all about service. Yes, it is a business, but it's service first. That's the premise of what we're all about. So if you have something that you'd like to promote, I'm just the one who would love to help you get it out into the stratosphere. Remember, leading ladies, leaving legacies. Style with Joy, not on the back burner, still in place. In fact, for mid-November, I'm doing my first masterclass, and you are invited. All that information will be coming up and about soon. In the meantime, be and stay well. Wear that mask for you and for others. Stay well, stay safe, and join me next week, same time, same station, and tomorrow night as well. So long for now. Thank you for being here. So long. Cheers. We appreciate you. Every week you will meet professional men and women who stand out in the crowd, growing their business in style online. Join us each week. Want to be a guest? Let's make it happen. Connect with me on my website. All the best. Cheers.